Hey everyone, Cameron Giardini here with Boomer Health Group, and this video is going to cover a topic concerning different types of Medicare Advantage plans. So oftentimes we always say you got to pick between Medicare Advantage or Medigap. Now, the other thing you have to look at is when you do pick a Medicare Advantage plan, there are different types of Medicare Advantage plans, and those typically come down to a Medicare Advantage plan that is a PPO or one that is an HMO. So you can see on the screen here, HMOs refer to health maintenance organizations, and PPOs, they refer to preferred provider organizations. So a lot of you may be pretty familiar with these terms by now, as over the past couple decades they've been more common in the workplace. And what HMOs and PPOs are essentially designed to do is they give you a smaller network of care in exchange for lower cost. So an HMO is the most extreme version of that. And an HMO, many of you will know, is the most narrow of networks, which means as long as you're in the network, you pay a lower cost, but outside of the network, you essentially have no care. So this is pretty common with companies like, I would say, HAP, for instance, in Michigan. They contract a lot. They have a limited HMO with just Henry Ford. So if you go to Henry Ford Physicians, then you're going to pay a lot less than you would anywhere else, and you wouldn't even have coverage if you went to outside health systems, maybe in a different state or in a different region of Michigan. And this is pretty common all throughout the US. Kaiser is one that's big out in California. There's different plans everywhere in different health systems, but essentially, if you look at this chart, and I'll link to it next to the video, but an HMO has the smallest of networks, and there's no outside coverage for visits outside of emergencies. So that means that if you do want to go to a doctor for whatever reason, as long as if it's not an emergency and you go see them for a surgical procedure, you have to pay the full cost of that procedure. And you can see here too, HMOs, one of the characteristics is you see only in-network providers. When you visit doctors outside of your service area, it really has to be an emergency for it to be covered. And then the other thing is that you typically do need referrals from a primary care physician to use an HMO. So if you want to go see a specialist like a heart doctor, you typically need the referral from your primary care doctor in order to first see your cardiologist. And this is, again, it's designed to save costs. It's designed so your primary care doctor is like the quarterback of your coverage. It's not always that case in Medicare where you do need a referral, but just remember HMOs do typically come with that stipulation. Now, the other side of this is a PPO, or a preferred provider organization. And the key here is somewhat the word preferred, and it just means that you have a network that is in network, but you can go elsewhere at an out of network cost. So this gives you more flexibility if you're traveling. You can see essentially any doctor in the country. It will be a higher price, but it doesn't have to be an emergency for it to be covered. So again, they have the preferred network that you're going to have the most cost savings, and then the out of network. And that's where the preferred provider organization name kind of comes in. So you can see here, you don't need a referral to see a specialist. You can visit doctors anywhere in the US, but you do pay more if you go out of network for that. I would say we typically recommend the PPO because there are still very low cost options for a PPO with a Medicare Advantage plan. But it just, if something pops up throughout the year and you really, really want to go out of the network or to a different facility, at least you have the peace of mind knowing you can do that. So it's not something that, like an HMO, you'd be limited to just staying in your network of care. And you can see here too, I wanted to draw attention to something that's a little bit newer, and that's an HMO POS plan. And POS stands for point of service. So this is somewhat like a hybrid plan, and this is from Priority Health, their website. They're describing what the HMO POS is like, and essentially it's like your typical HMO where you do have the limited network and the cost savings, but they also have systems in place where if you want to go see a provider outside of the network, you can get that set up with a referral from your physician, and you can there are differences basically. It's not you can go anywhere like a PPO, but you don't have to only stay in network like the HMO. You can have certain situations where it becomes a hybrid of the plan. So if you have any questions about that, let us know, because each plan's HMO POS is a little different. For example, Priority Health, they don't require referrals with the HMO POS, where other plans will still require referrals. So again, minor differences, but they are, I would say, important to look at when it comes to deciding the plans. And I just want to show you one more thing here. So when we're talking about why we recommend the PPO, this is really the biggest thing for me. So if you go on most of summary of benefits for plans, you'll see a huge chart just like this for any company, and it'll say this is what you pay per month, this is what you pay at the doctor, all your copays associated with Advantage plans. Well, the biggest one is the maximum out-of-pocket responsibility. So on priority right here, you can see the left side of this page is all HMO POS plans, and the right side is all PPO plans. So like I said, if you have a procedure or an illness that comes up in the middle of the year and you don't want to go in network and you want to go out of network, with an HMO POS plan, you only have a max out of pocket for in-network procedures. So if you get a $20,000 procedure in network, with this priority plan, you're capped at only spending $4,200. If you do that same $20,000 procedure out of network, you could be on the hook for the full $20,000. So yes, you have flexibility to go outside of the plan with the POS style, but you don't have the financial cap or the financial flexibility to do so. Whereas the PPO, they have in-network, they have a cap, typically a little bit higher than the HMO, but they also have this, which is very important, the in-network or the in and out-of-network combined max out-of-pocket. So you can go have a specialty procedure at an out-of-network facility, and at least in this case, you still have a financial cap. Now, I'm not saying get a PPO and just go anywhere in the country anytime, but it gives you a little bit more flexibility and peace of mind knowing that if something does come up, you have that financial cap, and it's not going to put you out of a lot of savings or potential pitfalls that the HMO plan might have. So again, if you decide on a Medicare Advantage plan, then you really got to look at, do I want an HMO or a PPO? Do I travel? There's a bunch of different factors that go into it, but those are the main ones. So if you do have further questions, let us know. But thank you for watching this video.